Andrew.
Good morning to you. Now, tomorrow is apparently Freedom Day. All remaining legal restrictions to combat COVID-19 in England vanish. But in this third wave, new daily infections are already about 50,000 and could soon be twice that. Hospitalisation rates are rising and deaths too. Parts of the NHS are already closing for other work. With 500,000 people told to self-isolate, food processing, railways, many restaurants and factories are short of staff and shutting down. So it's a funny kind of Freedom Day. Lots of people will carry on wearing masks, and the Prime Minister, normally so bullish, is urging extreme caution. Now, no one knows exactly how medically dangerous this point really is, but it is, if nothing else, politically very risky. And whether the vaccine wall holds is the biggest gamble for the Johnson administration so far. On an absolutely critical weekend, I was supposed to be joined by the new Health Secretary, Sajid Javid. But perhaps a sign of the times, he has tested positive for COVID and is self-isolating. In his place, I'm joined by the Housing Secretary, Robert Jenrick, by the Shadow Health Secretary, Labour's Jonathan Ashworth, and by the epidemiologist whose modelling has been absolutely central to shaping government policy throughout the pandemic, Professor Neil Ferguson. Also this morning, after a week when parts of central Germany suffered a devastating deluge, I'll be talking about the effects of climate change and whether extreme weather events will become increasingly normal sooner than predicted, with Hans Bruyninckx, the director of the European Environment Agency. Reviewing the news, the editor of The Sun, Victoria Newton, who got the Matt Hancock scoop, and our own deputy political editor, Vicki Young. This is our last show before the summer break. I think it's going to be a belter. Let's start with the news and Ben Thompson.
Andrew, thank you. Good morning. The Prime Minister and Chancellor will not be self-isolating after contact with the Health Secretary Sajid Javid, who has tested positive for coronavirus. Downing Street said the pair would take part in a pilot programme where daily tests replace self-isolation. Both Boris Johnson and Rishi Sunak were contacted by NHS Test and Trace as contacts of Mr Javid. The search continues for hundreds of missing people in Western Europe after record rainfall caused devastating flooding. More than 170 people have been killed across Germany and Belgium. Chancellor Merkel is due to visit affected areas today. Scotland is bringing in the same quarantine rules as England and Wales for travellers who are returning from France. From tomorrow, fully vaccinated people returning from amber list countries will no longer have to self-isolate for 10 days, but the easing of restrictions will now not apply to France. 2 athletes have tested positive for coronavirus in the Olympic Village in Tokyo. Organisers say they are from the same team and sport as the official who failed a test yesterday, but no further details have been revealed. And Silverstone will host the biggest sporting crowd since the start of the pandemic this afternoon. 140,000 fans will head to the track for the British Grand Prix as Lewis Hamilton looks to keep his title hopes alive. That's all the news from me for now. The next on BBC One is at 1 o'clock. Andrew, back to you.
Many thanks for that. And now, as ever, to the front pages. And if I can put this gently, they're probably not the front pages Number 10 was hoping for on the eve of Freedom Day. Downing Ping street chaos, says The Sun. Freedom Day, says the Sunday Mirror. Summer freedom farce, says the Express. Sajid's COVID sparks Number 10 ping-demic, says the Mail, and on it goes. The Observer, Sajid Javid tests positive as health chiefs tell the Prime Minister, don't let COVID rip. Sunday Telegraph has an interesting hard news story here saying that only very vulnerable children and small numbers of older children are going to be jabbed, and so the rest of them are going to have to live with the pandemic. And the Sunday Times, Britain's sweltering in Freedom Day mayhem. And they're focusing on the so-called ping-demic, the number of people, 500,000 and more people self-isolating, and the effects of that all across the economy. Vicki, let's start with you, but let's start by talking about the news this morning, which is that the Prime Minister, who spent, a couple of hours opposite Sajid Javid, while Sajid Javid had coronavirus, is not self-isolating. Why?
Yeah, that's right. So Sajid Javid tested positive on Friday. He had meetings with the Prime Minister, but we've had a spokesperson from Number 10 this morning saying that the Prime Minister and the Chancellor have been contacted by NHS Test and Trace as contacts, but they are participating in the daily contact testing pilot, which allows them to continue to work from Downing Street. You have to take a test every day and then you can go out for essential reasons. This also applied to Michael Gove, you remember. He went to a football match in Portugal.
That's very convenient for all concerned, isn't it?
Yeah, so this scheme covers a variety of workplaces, including TfL, apparently, Transport for London, Network Rail, Heathrow and Border Force. It includes Downing Street and I think the Cabinet Office too. And then it does seem that some people who are phoned up by Test and Trace, contacted, they are given the option of joining it, but it's not guaranteed. So some members of the public will be allowed to do this as well. But I think some people will be surprised about all of this, that they don't have to isolate like so many hundreds of thousands of others have to.
Victoria Newton, a lot of people will be saying one rule for them, one rule for us. What do you think your readers will make of this?
That's absolutely right. It's outrageous, isn't it? Michael Gove did the same to go to a football match. It's just do as we say, not as we do. And that never works with a politician, whether they're from the left or the right. This government should know better.
I suppose one of the questions, Vicky, is what it does to the moral authority of ministers who are telling people to self-isolate. 530,000 people, I think, at the moment self-isolating. And that's the origin of this great phrase, the pingdemic.
Yeah, that's right. And that's the app, of course, which pings and tells you you've got to isolate. And then people like Tony Blair and others, of course, pointing out that this is having an impact on the economy. Warnings here about empty shelves in the supermarkets, about not being able to get food. There's drivers, they're short of that. There's lots of people obviously going home and not being able to work. And we know, of course, school children, 800,000 have been isolating in the last week or so. So warnings about the economy and people saying, you're doing two things here. You're opening up and lifting all restrictions in England on Monday. And yet you're trying to say to people to be cautious. And so some people are struggling with that. Others, of course, will say, look, we do have to treat this differently. We have vaccination. You talked about the vaccination wall. It does have holes in it. But the difference now between the number of cases we have now, and they're rising, and when they were back in January, is that the deaths are at nowhere near the same level.
That's absolutely right. Victoria, you've got quite a strong leader this morning, really about the number of people self-isolating and the effect of the app on the economy, road haulage, food processing, manufacturing, factories of all kinds, hospitals, and so on and so on. What's your message to the government about this?
They need to fix this Test and Trace app immediately. It's clearly not fit for service, brought in by Matt Hancock, inherited by Sajid Javid. But we can't go on like this with potentially 5 million people being pinged. And there are so many glitches in it. In my own case, my son's school was shut down for a week because there was a mistake on the app. And it's the number one subject that's been talked about all week in our office, I can tell you that.
Do you think the app needs to be abolished, as it were, or do you think it can be tweaked to make it less sensitive?
I'm clearly no algorithmic expert, but they were planning to make some of these changes on August the 16th to mean that people who are double vaccinated don't then need to isolate if they get pinged. I mean, that would be a start. Just bring that right forward to tomorrow.
And that is what the Sunday Times is talking about, isn't it? Sorry, you've got that. You've got the Mail there.
Yeah.
Vicky. Yeah. So Tony Blair has given an interview in the Sunday Times where he says, actually, this is ridiculous. If you're double vaccinated, you should not need to self-isolate.
Yeah, that you should be treated differently. And lots of people saying, what's the point of the vaccination programme if you can't benefit from it? And that was certainly the argument from lots of Conservative MPs too, saying, look, we have done really well with that. So it really is time that we opened up and moved on from all of this. Now, as you say, the rules are changing on the 16th of August when it comes to isolation for those who are double jabbed. But I think there was some reticence in government about treating people differently. Of course, lots of young people haven't had their jab, therefore they will be more restricted in what they can do.
And the young are absolutely critical to this now, aren't they, Victoria? There's a story in the Mail about the importance of vaccinating the young, though the Sunday Telegraph reports that it's only going to be particularly vulnerable and special groups of young people who get the jab.
Yeah, I think there's two important things there. There's first of all the fact that the under 30s are not getting jabbed enough. So we need to desperately encourage more people from the age of 18 to 30 to go and get jabbed. There's a tendency when you're young to think you're invincible, but getting a vaccination means you can go on a holiday and also, more importantly, protect people older than you. And then, yeah, the Sunday Telegraph story is an interesting one. So they're basically saying that the Vaccination Committee has decided that children under 16, so between age 12 and 16, shouldn't be vaccinated unless they're vulnerable. Some countries like France have decided to vaccinate 12-year-olds, but there's some doubt about how safe it is and whether it's the right thing to do. So we seem to have decided not to.
So lots of confusion this morning, Victoria, and of course I was hoping to interview Sajid Javid. It's really your fault that I can't have him here, because had you not pursued the Matt Hancock story as you did, it would be Matt Hancock sitting in front of me today. I know you've had a lot of trouble and a lot of worry about the way the investigation into whistleblowers has been pursued. Just tell us where you've got to now.
There was an outrageous raid on the homes of two people earlier this week, suspected whistleblowers. I can't really say much more about that, but the idea that the Information Commission thought that it was right to do that when the story was clearly in the public interest, and all this is going to do is in the future stop whistleblowers coming forward to papers like The Sun or The Mail or The Telegraph, who've got MPs' expenses, and indeed the BBC relies on whistleblowers to bring scandals to our attention. We can't have a democracy where the only place somebody can go to expose wrongdoing is the place where they work, because it won't get exposed. So I'm just staggered, really, that they thought it was in the public interest to do this.
And you've said you'd rather go to jail than reveal the names of your informants. Is that right?
That's right. To be clear, they haven't asked us for anything yet, but if they do, we'll fight them in court.
All right, let's turn, Vicky, to the other big issue, which is holidays and the great confusion over France, because France has something called the Beta variant, but on the island of Réunion, which is 6,000 miles away from mainland France, and yet they have put on this special new France-only category of Orange Plus.
Yeah, we're not quite sure which category they're in. It is a new one. And it means that even if you're double vaccinated and you return from France, you will have to isolate at home. So they have been singled out. Now, the government says about all of this is it is to do with the Beta variant, originally from South Africa. And there is some concern that the AstraZeneca vaccine doesn't protect people as well from the Beta variant. So that's why they're doing it. They also point out that actually, yes, although there are lots of cases on the islands, actually there are lots of cases too on the mainland of France. Now, I've had Conservative MPs getting in touch with me saying, look, we can't win here. When we didn't lock down against India early enough, we've been completely lambasted for it. Now we're doing it with France. We're also being lambasted for it. So they would say that they're being cautious on all of this. But of course, for people who want to go on holiday, this all feels very last minute and they're going to have to, buy those tests and isolate when they come home.
Vicky, let me turn away from the pandemic finally for a big story about the economy, because we know that the Chancellor, Rishi Sunak, and the Prime Minister are not self-isolating. That allows them to have more arguments face-to-face about social care.
Yeah, it does. And this is a huge issue, which is, as you know, been going on for actually decades. So this is the idea of how do you deal with the cost of social care and to stop families having to fork out hundreds of thousands of pounds sometimes. You get NHS treatment for free. Why shouldn't you get the same when it comes to social care? So how are they going to pay for all of this? The Prime Minister is very keen, it seems, to get this sorted. He promised he would do it. Rishi Sunak, as ever with chancellors, maybe not quite so keen. The idea being floated here is for a one-off tax. They might call it a levy to get around their manifesto problems. 10 billion a year. Yeah.
Victoria, what's the view of the Sun about some kind of special levy or tax to pay for social care? Because clearly somebody has to pay for it.
They do, yes. We don't like taxes going up in any shape or form. And clearly this is a problem for Boris, because a couple of years ago he stood on the steps of Downing Street and promised a solution. And it sounds to me like they don't agree on any solution yet. Rishi is never going to want to put that tax up, and neither's Boris ahead of the election. So I'm not sure where they'll end up.
Right, one other story I must ask you about, because it's all over your paper this morning, is, as it were, the hunt for the Wembley yobs, or the people who broke into Wembley. How is that going? Do you think you've identified the ringleaders?
I'm sure we'll have had some calls while we've been on the air, to be honest. We usually do. The behaviour was totally outrageous. I went to the England-Croatia game right in the early rounds, and that actually was a joy because it was so empty. There were so few people. But I have to say, what was so shocking was even I showed my NHS app with my certificate on it on the phone, and they just looked at it. No, there was no testing of it via a scanner or anything. And all the reports I've heard for what happened at the ground was a total disgrace, with yobs smashing in the turnstiles and bribing officials. There was the one particular one that we exposed in the week was just an amazing story.
Victoria Newton, editor of The Sun, Vicki Young, our deputy editor, thanks both very much for a very interesting paper review, and so to the weather. There are people who whinge and moan all year about the rain and the cold, and then, when proper summer arrives, immediately start to whinge about it being too hot. I am one of them. Over to Thomas Schaffenacker in the weather studio. Thomas.
Andrew, thank you. Well, if you have a garden, can I suggest that maybe you sit in a little paddling pool? That'll cool you off a little bit. It certainly is going to be hot today. Look at that, 30, 31 degrees across some southern parts of the UK. Not as hot in the northwest of the country as it was yesterday. Yesterday it was 31 degrees. Today, not quite so hot here, but high pressure over us. You can see a lot of cloud across parts of western Scotland and the north of Northern Ireland. Sunny skies elsewhere, just the outside chance of a shower this evening, afternoon and evening in the east. Balmy nights tonight, 17 or 18 degrees across the south of the UK. A lot more comfortable in the north, 12 in Glasgow and Edinburgh. And then tomorrow the high pressure is still with us. You can see the same weather pattern, a bit more cloud here. But generally speaking, the winds are going to be, I think, even lighter tomorrow, which means it'll feel every bit as hot. But the temperatures will probably spark off 1 or 2 showers, maybe even the odd thunderstorm in the south. Maximum temperatures tomorrow around 29 degrees. And how long is this fine weather going to last? Well, the high pressure and the settled weather is expected to last for the whole week, pretty much. Towards the end of the week and into the weekend, it looks as though we could get some showers. But Andrew, yeah, I think hot weather is the story for the next few days.
I will carry on sweltering and whinging. Now then, Jonathan Ashworth, the Shadow Health Secretary, is with me. First of all, Mr. Ashworth, you are pinged, or you're told you've been in contact with somebody who's got coronavirus. Shall we say, for instance, the Health Secretary? Do you then self-isolate?
Yes. Yes, you do. And I think there will be parents watching the programme this morning who have had to struggle with their children sent home as part of the bubbling system. Or there'll be businesses who have had to struggle because their staff have been pinged and they've had to isolate themselves, who will be waking up to this news thinking, my word, yet again, it's one rule for them and another for the rest of us. People will be asking, how have they got access to this special VIP test and release system that applies to them but doesn't apply to the rest of us? I just beggars belief.
Right, well, maybe really strong political opposition would help to change this situation. The Liberal Democrats say that opening up tomorrow is reckless and it should not happen. What's your view?
Opening up tomorrow is reckless. It is like putting
against it?
It is like putting your foot down on the accelerator and throwing off the seat belts. We would open with caution. So we would maintain mandatory mask wearing because people want to do the right thing. They want to wear their masks, but they want to feel protected that others are wearing their masks. We're probably going to have one of the busiest days on the transport network tomorrow for 16 months. Why can't people continue to work from home, have the right to work from home?
So to be absolutely clear, the Labour Party is against the full opening up tomorrow morning.
We are against opening up without any precautions in place. So we are saying keep masks, allow people to work from home. Why don't we use our British manufacturing to put air filtration systems in every school and every public building? Why don't we pay people decent sick pay so they can isolate themselves?
I'll come on to all of these things, but you're not getting them, you know very well, at the moment. On masks, on sick pay, on ventilation, the government is not doing what you're asking it to do. And therefore, are you against so-called freedom?
Well, they're not just doing what we're asking. They're not doing what SAGE has asked, or the Academy of Medical Sciences.
Let's just come back to the question. Are you against Freedom Day tomorrow happening?
Well, we don't want Freedom Day to be a free-for-all day. And I think what is going to happen tomorrow is that infection rates will probably increase further. What we saw in the Netherlands when they had their Freedom Day on the 26th of June is that infection rates jumped up almost in a vertical axis.
I'm just trying to get you to say something fairly straightforward. It should not be happening tomorrow.
We are in favour of the economy reopening, but we would put in place a series of precautions to try and slow the growth and contain the growth of the virus, while at the same time going further to try and get young people to get the vaccine. And then we would look again at vaccination for adolescents.
I'm sorry, the confusion here is that none of that can or will happen tomorrow. And tomorrow the restrictions go. And I'm asking you, are you in favour of the restrictions going tomorrow or not?
No, we are in favour of proceeding with caution. So and tomorrow is going to happen anyway. Because
tomorrow is obviously going to happen.
Indeed,
but the question is, are the restrictions going to be lifted?
Well, the restrictions are going to be lifted
this?
anyway tomorrow. But we would not be releasing the restrictions in the way in which Sajid Javid is proposing. Because when he came 3 weeks ago, when he said it would make us healthier, it clearly isn't, because we've got hospitals under intense pressure, with cancer operations being cancelled, and of course we're running the risk, because of the way in which the virus works, of the pressure being put on the variant and another one emerging.
I understand all your arguments. What I don't understand is why you can't simply say this morning the Prime Minister should delay the ending of restrictions. No, that's not our position.
Why not? Our position, because we know that we need to get the economy reopened and moving again because of the...
It's a yes but no but position, isn't it?
With respect, these are complex decisions when you're dealing with a virus of this scale. Okay. But we would reopen the economy while putting in place a series of mitigating precautionary measures.
Well, let's look at some of those.
That's a material difference between us and the government.
You've talked about ventilation. All around the country, there's huge numbers of buildings which aren't properly ventilated. We know that. It's been compared to the situation of sewers in the early Victorian period. It's a massive job and a very expensive job to ventilate all the places. Would you advise people who don't feel that their workplaces are properly ventilated not to go to work?
Well, that's why we're saying to people they should have the right.
Yes or no?
The right.
Sorry. Yes or no? Would you advise them?
Workplaces need health and safety requirements in place. So yes, you are right, and that is why we're saying people should have the right to request home working. But Germany, for example, offered grants to buildings.
How much have they spent, and how much would it cost here?
Well, Germany offered around a £490 million grant for buildings to install these air filtration units.
And so you're in favour of that?
So we need to look at that. We've got British manufacturing is making some of these.
You say look at it, but are you in favour of spending a lot of public money?
Yeah, we need to support our buildings to reopen, and we can support British manufacturing by offering grants in order to put money into ventilation.
And then it takes time to do. Obviously, it's a big
you could do every
job.
You could do every. It's not necessarily. Some of these air filtration units are relatively discreet, and you could put them in every school over the summer in time.
Does that need to happen before we can reopen safely?
It should be happening. It should be happening.
Now, my question was, does it need to happen
before
we reopen safely?
Well, the economy is going to reopen tomorrow, but these are the things that should be happening.
It sounds like you've just kind of given up on opposing the government over doing something, reopening with all these things, which you yourself say is dangerous.
We haven't given up.
In that case, say you're against it.
We're putting forward a series of proposals, such as ventilation, such as home working, such as offering people decent sick pay, such as maintaining the mask mandate in society. These are a series of proposals which we're saying to the government would help you open up in a safer way.
We're going round and round in circles here, but I say again, you know you're not going to get what you want by tomorrow, for sure. And you say it's unsafe to open up without these mitigating factors and these policies. Therefore, are you against opening up tomorrow or not?
No, we are saying open up with these factors in place.
But you know they're not going to be in place. That's the confusion, isn't it?
Well, they're going to open up anyway, aren't they?
So you have given up?
No, we haven't given up, but we're putting forward our proposals as to how we think we can open up safely.
Do you think businesses should pay to ventilate themselves, or do you think the taxpayer should pick up that bill?
I think the government should offer grants for this, like has happened in other countries.
And how long do you think it would take to ventilate most of the buildings that we're talking
about? Well, you can install air filtration units and HEPA units into buildings, which can help with ventilation. It doesn't necessarily have to be a very complicated set of renovations to buildings when you can install the units, which we actually do manufacture in this country. And this would be a great way of supporting British manufacturing and supporting jobs. For somebody watching this programme today who's going to work tomorrow in an ill-ventilated building, would you tell them that's unsafe, don't go in? If there's no ventilation, yes, there should be ventilation in the building.
So don't go into work.
Well, they should have the right to request home working.
Right. Let's talk about social care.
Yeah.
There is a really intense, very, very important discussion going on inside government about how to pay for social care. Do you personally believe that taxes should go up to pay for proper social care in this country?
Well, let's see what is proposed.
No, I'm asking you.
Well, we obviously have to pay for social care. We always have to pay for social care.
How
And
is the
if the government is going to put forward a tax rise for social care, I think they would need to guarantee that the yield from that tax rise is hypothecated for health and social care. We know that Rishi Sunak is a tax rising chancellor. He wants to put up taxes on hard-working families. So he would need to guarantee that everything that comes from that tax rise goes into health and social care. That is the first thing.
A specific social care charge or tax only for social care you would back?
We wouldn't. Why would we oppose that because we want to see more money going into health and social care? But we would need that guarantee that it is going into health and social care. But we actually need a comprehensive package to fix the social care crisis. The cap that is being talked about in the newspapers today does not fix social care. If you cap social care costs at £50,000, apparently this is what Boris Johnson wants, that helps, according to some think tank analysis, around 50,000 people. If it's more like £72,000, which is what the Chancellor apparently wants, that helps around 12% of those within residential care. And yet, across social care, across the whole piece, you've got over 1 million people going without social care needs. You've got 75,000 people waiting for a social care assessment. And of course, we need to drive up the quality of social care. We need more than these 15-minute visits. We need, we've got 1 in 6 care homes not considered inadequate by the CQC, and we need to pay the staff properly. So you need a comprehensive package.
And that all needs more taxation income.
It needs more funding. So where is that going to come from? A cap in itself obviously helps those who are currently facing catastrophic care costs. It's better than nothing, but it doesn't help the 1 million people who are going without social care.
All right, Jonathan Ashworth, thank you very much indeed for joining us. Now, at least 180 people have died in flash flooding across Germany and Belgium this week. As attention now turns to the huge clean-up operation, people are questioning if this is a precursor for worse to come. European leaders have squarely blamed the extreme weather on climate change. Just before we came on air this morning, I spoke to Hans Bruyninckx, the Executive Director of the European Environment Agency, and asked how unusual these floods are.
Well, extremely unusual. These are the biggest floods in a really long time. And when we speak about the track records of monitoring precipitation, we're talking about a once in a couple 100 years flood as far as we go. In Germany, it's 1 in 200 years at the moment. In Belgium, we've actually never seen floods of this magnitude over the last century.
And a lot of people watching this at home on television will think global warming. But how certain are we about that?
Well, by now, we are certain that global warming is causing more extreme weather events, whether it's floods or droughts or heat waves or hurricanes or other weather phenomena is increasing, and it is impossible to explain that without taking global warming as the main factor.
I suppose one of the things that will concern people is that we were told, so far as I can recall, that if global warming did not exceed 1.5 degrees, then there'll be less of these kind of extreme events. So are things accelerating, happening faster than we expected?
Well, yes, climate scientists are telling us very clearly that the effects of global warming are indeed in a number of areas speeding up. They are going faster than what they thought. And I can refer to the melting of the ice caps, for example, but also in terms of some weather phenomena. Yes, that is indeed the case. And we are globally not even at 1.5 degrees right now. And we are on a trajectory towards 3 to 4 degrees average temperature increase over pre-industrial time. So the models are predicting that this type of events will increase in magnitude, increase in frequency, and of course lead to more damage over time.
And I suppose with a very small change in the weather pattern, this could have happened not over Germany, but over Britain. Nobody is immune from this. Can I ask, as you survey the damage at the end of this, what your message would be for political leaders gathering in Glasgow for COP26?
We need to go to net zero emissions. We need to go to a climate neutral economy as soon as we can to limit the average temperature increase. The second message is that since climate change is happening, we need to focus also on what we call climate adaptation. We need to do as much as we can to prevent the damage from this type of events, or to deal with heat waves, or to deal with droughts.
Mr. Bruyninckx, in terms of adaptation, a lot of your country and a lot of the east of England are very low-lying. How big are the changes of policy going to have to be to deal with the problem of flooding in those low-lying areas in particular?
We know that there are people living today, and we are even building new houses and new developments in places that are very prone to flooding. And so if we cannot deal with these other methods, with potential flood risk, we may have to ask people to move. And of course, that might not be popular, but there is quite a bit of research also on why that is the case, where that would potentially be the case, because other solutions are just simply not possible.
Mr. Bruyninckx, very best of luck for the crisis that you're still facing in Belgium and in Germany. Thanks so much for joining us.
Thanks for having me. Have a nice day.
Thank you. Sage advisor Professor Neil Ferguson's modelling has been central to advising the government's decisions from the very first days of the pandemic. And so, on the eve of the biggest change to our collective behaviour since the imposition of lockdown, how confident is he about what might happen next? Professor Ferguson is with me in the studio, and that really is my question. Cases rising above 50,000 and shooting up towards 100,000, some people say. All restrictions going tomorrow. Where are we heading?
It's very difficult to say for certain, but I think 100,000 cases a day is almost inevitable. We have two things happening next week, though. We have the relaxation on Monday, but significantly, we also have school holidays starting on the Thursday of the week. And we've seen a lot of transmission among teenagers, and that probably will, those contact rates will tick down. So we're in a position, and the SAGE summary of the modelling last week said, where it's very difficult to make precise predictions. I think it's almost certain we'll get to 1,000 hospitalisations today per day. It'll almost certainly get to 100,000 cases a day. The real question is, do we get to double that or even higher? And that's where the crystal ball starts to fail. I mean, we could get to 2,000 hospitalisations a day, 200,000 cases a day, but it's much less certain.
And what would the consequence of that be for the NHS?
So at that sort of level of 2,000 per day, which is roughly half what we got to before Christmas with the second wave, there you are talking about major disruption of services and cancellation of elective surgery and the backlog in the NHS getting longer and longer. I have to say, I mean, it's looking like people being hospitalised now are not as severely ill as they were back in December and January. I mean, the mortality rate is much, much lower. But still, if you have enough cases, you can still have quite significant burden on the healthcare system.
So I'll come on to the consequences of that in a minute. But nonetheless, at this stage, we really don't know which way it's going to go. So can I ask you, what would success look like?
Success would be keeping hospitalisations at around the 1,000 a day level and then declining. Case numbers maybe peaking a little over 100,000 a day and then slowly declining. It is likely to be a slow decline. Because we will be seeing gradually contact rates increase with this relaxation. People will be probably conservative, but still contact rates will increase. And yet we're still vaccinating people getting immune from being infected as well.
So the virus is running hot. What's the consequences of the virus, as it were, running hot, particularly among young people?
We're seeing very high infection rates now. We've seen the impact on schooling, but we'll have probably impacts also on long COVID rates. Mm-hmm. We know now that probably around a quarter of people who get symptomatic COVID, get symptoms, have those symptoms for a long period of time. And so we're at about 1 million people with long COVID from Office of National Statistics. Numbers go up to another 500,000 on top of that.
Good grief. We know that a lot of your colleagues, other scientists from around the world, are looking at the British experiment, and they're worried about new variants emerging as a result of what we're doing now. Is that a real worry?
It is something of a concern. We obviously ran quite hot in the autumn of last year, and we saw the alpha variant, as it's now called, emerge. And the more people are infected, the higher chance a mutation will arise and a new variant will arise. It's impossible to predict whether that's going to happen. But the risk is higher if you have high numbers of cases.
Now, in terms of where we might be going, people talk about herd immunity, which simply means the number of people with antibodies, for one reason or another, is so high the virus has nowhere to go and, at least for a period, vanishes. Can I ask how near herd immunity we are now?
Well, if I could answer that question, I'd be able to tell you when the epidemic was peaking. Fundamentally, this will be a different wave from the previous two. The previous two peaked because we introduced lockdown measures, and that's the only reason. This time, if we don't have to change course, then it will peak because herd immunity has been reached. And then it overshoots and you still get infections beyond that point, but the epidemic will be in decline. That's, of course, what we're hoping for. But the reason we don't know is we don't know precisely what the level of immunity is in the population. We have very good data on the vaccines, but not perfect.
I mean, it's been suggested that around 70% have got enough antibodies at the moment, and that if 90% was the figure, that would get us to herd immunity. Is that the kind of numbers that you recognise?
It's hard to put that precise. I mean, they're broadly right. We know that 2/3 of people now, 2/3 of adults have had 2 doses. That gives them nearly 100% protection, but not 100%. So it's more complex because it's leaky. Immunity is not all or nothing. It's a grey scale.
Sure. So could we get to that 90% or something like it without children being infected in very, very large numbers or being vaccinated, which we're apparently not doing?
In the absence of vaccinating teenagers, it's inevitable that we're going to have we're already seeing very high numbers of cases in teenagers, and we won't be able to reach herd immunity without significant immunity in basically people under 18.
So how long before we know whether this strategy is going to work in terms of getting towards herd immunity? How long did it take?
Well, we'll know it's worked when case numbers plateau and start going down. We know then hospitalisations and deaths will take some more weeks. And the best projections suggest that could happen any time from really mid-August to mid-September. So we will have to be patient. It'll also take us 3 weeks before we know the effect of Monday, of relaxing restrictions, and what that will do to case numbers. So it's going to be quite a period of time.
6 crucial weeks or so ahead, possibly from now on?
Exactly. I mean, 6 to 8 weeks.
Now, I know these are very, very difficult questions, but people at home are going to really want to know whether there is any likelihood, in your view, of returning to restrictions.
That will be a decision for the government, but clearly, if we end up in a more, let's say, worst-case scenario,
the higher end of what you're
the
saying.
higher end of the modelling and the projections of 2,000-3,000 hospital admissions per day, there may be a need to basically slow spread to some extent.
Do you think we're going to have to lock down again before Christmas?
It's a very difficult. I mean, you're asking me about 6 weeks ahead. That's harder. That's hard enough. Locking down and looking towards Christmas is even harder. I hope not, but I can't be certain.
And can you just sort of paint a picture for us what the rest of this summer is going to look like, and then running into the winter, when you're thinking about all the pressures on the NHS and the speed with which the virus passes around?
So it's going to be a difficult summer, for many reasons. People talk about test and trace and isolating. Actually, that has a purpose of people isolating, reducing transmission. I think case numbers are likely to be declining at least by late September, even in the worst case scenario. Going into the winter, I think we'll have quite a high degree of immunity against COVID. There, the real concerns are a resurgence of influenza, because we haven't had any influenza for 18 months. Immunity has waned in the population, and that could be, frankly, almost as damaging both for health and for the health system by December, January, as COVID has been this year.
And we're all relearning our Greek alphabets, but there's worry this morning about the beta variant in France. Should we be concerned about that? And
it's been monitored for quite a while. So beta, what used to be called the South Africa variant has been about 5% of cases in France for several months, and it's not going up. Actually, Delta is their concern. They're seeing very rapidly rising Delta case numbers. The reason Beta is a particular concern for us is these variants slightly escape the immunity given by vaccines, slightly compromise vaccines, and Beta does so a little bit more than Delta, which could be a concern in a very heavily vaccinated population such as the UK. Probably not right now, probably more in the autumn to winter time.
One final question. Tomorrow morning, lots and lots of people are going to be asking themselves whether or not to put a mask on for different situations. Do masks really work?
It's like everything else. I mean, nothing is perfect. Not even vaccines are perfect. They have some effect on transmission. They work best at preventing you infecting someone else. And lots of people, including double vaccinated people, such as the health secretary, are getting infected, are probably infectious. And if they wear a mask, even if they don't know they're infectious, that'll reduce the risk, but probably only by 20% or so.
I noticed that you were wearing a mask when you came into the studio a little while ago. Are you going to carry on wearing masks?
Given the circumstances, I'm going to continue my behaviour as I have been really for the last few months, at least until the autumn.
Yeah. All right, Professor Ferguson, thanks very much indeed for talking to us this morning. Much appreciated. Now, the papers today are full of stories of a pandemic in Downing Street. I was meant to be joined by the Health Secretary, Sajid Javid, but he's tested positive for coronavirus and he is self-isolating at home. The Prime Minister and the Chancellor are not, despite having met him face-to-face in recent days. Why not? We're joined from Birmingham live by the Housing Secretary, Robert Jenrick. Mr Jenrick, very straightforward question. 540,000 people in this country have been told to self-isolate and are self-isolating. The Prime Minister and the Chancellor are not. Why not?
Well, good morning, Andrew. As you say, the Chancellor and the Prime Minister have been contacted overnight by NHS Track and Trace, which shows that the system is doing its job. They will be isolating, but using the pilot scheme for daily testing, which is available to a range of public sector organisations, which enables you to do your essential business and get tested on a daily basis in specialist asymptomatic testing centres like the one that there now is in Downing Street, but then outside of that work environment to not socialise, not mix with other people. So it clearly is a less restrictive form of isolation than many other members of the public are enjoying.
It's very convenient. The editor of The Sun, Victoria Newton, said it was outrageous and clearly an awful lot of people are really, really angry this morning and feel it's one rule for you lot and one rule for the rest of us.
Well, the scheme is a well-known and long-standing one. It's not just available for politicians, if you like. It's being used by 20 organisations in the public sector, including large ones like TfL that runs the transport network in London and like Border Force. Downing Street is part of that pilot as well, and it ensures that the PM, the Chancellor, can conduct the most essential business, but at other times of the day, they won't be mixing with people outside of their own households.
You say essential business, but there are lots of doctors meant to be conducting operations and people doing other essential things up and down the country who have been told to self-isolate and are self-isolating. Is it simply a coincidence the Prime Minister is on this pilot scheme?
Well, as I say, there's a whole range of public sector organisations that are part of this particular pilot. We'll learn from this pilot. And so if it does succeed and is proven to be safe, then it may be available to more people. On the broader point, Andrew, if I may, on the broader point, we are obviously keeping under review whether or not the current arrangements are the right ones. Well, from mid-August, we're going to move, we hope and expect, to a different arrangement whereby if you're double vaccinated, then you won't have to self-isolate in the same way. And from tomorrow,
we'll
Monday,
come on to all of that. We'll come on to all of that in a minute.
Bubble system will come
on
in,
to
so
all
that
of
will
that
help
in a
people
minute.
as well.
But I want to ask you, who made the decision that number 10 was going to be part of this pilot scheme?
I don't know that, Andrew, but it has been part of it for some time. It wasn't a recent decision.
This is about moral authority. This is about, as it were, the population listening to the government's advice and deciding to abide by it. And this is the kind of thing that makes people ask, why should we self-isolate? Why should we keep our apps on when the Prime Minister and the Chancellor and other ministers seem to get outside the system, get around it?
I understand that, but this is a pilot scheme that is involved with a range of different public sector organisations, not just Number 10 Downing Street. I've listed some of them already. It doesn't involve others. I mean, my department isn't part of it, and so the normal rules would have to apply to me and many other members of the government, as you'd expect.
Up and down the country.
I would just say, Andrew,
up and down the country, people are asking themselves, why should we self-isolate when the government are not? I'm going to give you an example of somebody called Ruth Adams, and she runs a company in Bristol which happens to make bathrooms, and she has deleted her NHS app to stop her business from going under. She says, if someone else is told to self-isolate, then that would be an absolute catastrophe. I am not going to take the risk because this company couldn't stand to have another member of staff not available for work. Why can't she be on the pilot?
Well, the NHS app and Test and Trace are a very important tool in our toolkit to tackle the virus at this critical stage. The evidence from a survey, for example, in the last 3 months of last year showed that it had helped to avoid 600,000 cases and to ensure 8,000 unnecessary deaths were avoided. So it is important that these I was pinged, if any other member of the public were pinged, that they do take it seriously and follow the guidance, because it is one of the ways in which we as a country will get through the difficult days that undoubtedly still lie ahead.
You say that, but let's just remind ourselves what all these people being pinged is doing. Railway companies up and down the country are cancelling services. Big manufacturing companies like Rolls-Royce are talking about having to close down or pause for cancels. Doncaster and Derbyshire and other councils are cancelling their bin services. Hospitals from Raigmore in Scotland to across the UK are cancelling operations. Right across the country, the entire economy is being brought to a kind of juddering halt in many places by your policy. Can I ask very straightforwardly, have you really got this under control?
Well, can I explain why it's important that we do follow the guidance when we receive that? Well, the reason, what you're suggesting, Andrew, is that it would be better. What you're suggesting is it would be better not to ask people to self-isolate, and we disagree with that. We think this is an important part of our plan to keep the virus under control. The app is doing what it's been asked to do, which is to contact those people who've come into close contact with people who've tested positive for COVID-19. Cases are rising, and that's driving, of course, more people to be contacted as well. What we're going to be doing in the days ahead are, firstly, from Monday, school bubbles will be retired, and so that will help with young people and families, and of course with the school holidays fast approaching, that as well will make a big difference, I expect, in reducing the number of people being asked to self-isolate, because that's been very problematic in recent weeks. And then secondly, from mid-August, we'll move to a point whereby if you're double vaccinated, then you shouldn't have to self-isolate in the same way. You will need to follow the testing requirements. And the reason for the delay is to ensure that more of the population is double vaccinated.
I was going to say, why will it be safe then if it's not safe now?
Well, there's no full safe way of doing this.
Because you're not vaccinating children. You're letting this run hot among the younger population.
Well, firstly, in that 6-week period, we will be able to further double vaccinate the adult population. We've reached this big milestone this weekend whereby 2/3 of the adult population have been double vaccinated, and every adult in the whole country has been offered at least one vaccine. But there's still a lot of younger people who haven't had the second jab. Hopefully, many of those will come forward in the coming weeks to get the second jab, and of course we're urging them to do so. On the question of young people, which you raise, we're still awaiting the final guidance from the JCVI on whether or not we should start vaccinating people under 18. We're very sympathetic to that argument. It seems like a sensible thing to do, and ministers armed with that advice will be making a decision very soon.
But you are still, the Prime Minister is telling people in the food processing industry, the haulage industry, the transport industry, factories, etc., to self-isolate. But he's not prepared to tell himself to self-isolate. And that is the problem. You have a big public messaging problem now in terms of why should we listen to you?
Well, all I can say is it is important that if anybody is contacted by NHS Track and Trace, they do take the steps that are required of them. I appreciate it's frustrating and difficult at times. It is putting pressures on public services, on businesses and schools. However, it is an extremely important part of our way of keeping the virus under control. If we're able to roll out some of the pilots that we've been doing on a relatively small scale with certain parts of the public sector, then we will do so. And there is only, I say only because it's still a long period of time, but there is only till the middle of August before we move on to the next phase where those people who've been double vaccinated will not have to self-isolate in quite the same way.
Isn't the situation the Prime Minister either has to reverse his decision not to self-isolate himself, or he has to change the policy for the rest of us? Which should it be?
Well, we don't intend to change the policy, although we keep these things under review. We'll be guided by the expert opinion. The advice that we've received in the recent past has been that it would be better to wait this period of 6 weeks to ensure that more people are double vaccinated. That gives them more protection for themselves. Also, it decreases the amount of transmission that will happen as a result. So that's the plan, but of course we keep these things under review.
Professor Ferguson suggested that we could see very, very high levels of hospitalisations and that we might have to think about another lockdown or another reversal, certainly of restrictions. If that happens, has the government failed?
Well, I think we have to be honest with ourselves that we're going to see a significant rise in the number of cases and the number of people going into hospital. As Professor Ferguson said, it's likely that this wave that we've known about since at least the beginning of the year isn't going to peak until late August, possibly even into September. So there's going to be some challenging days ahead. It is true, however, that we've significantly weakened the link between cases and serious illness. The last time we had cases at the level we do today, the number of people dying from the virus was 30 times the number it is today. So we are in a much better position than we were at the beginning of the year, but it is going to be a challenging period. Of course, we will do everything we can to avoid having to impose further restrictions, and that's why we're urging the public to exercise caution, to exercise good judgment and common sense, and to go about daily life in a sensible, careful way, and to do things gradually rather than rushing back to normality, if you like, on Monday.
Does doing everything we can to avoid restrictions include allowing a large proportion of the younger people, children in this country, to become infected with COVID and therefore suffer the possibility of long COVID?
Well, we're very worried about long COVID. It's
So
an incredibly cruel and debilitating set of conditions.
Sorry,
we're doing,
so what are you doing about it?
Well, we're doing two things. Firstly, we're going to ensure that anyone who does suffer from these conditions is not left behind, that they're given the very best treatment that's available. We're still learning about the virus and about long COVID.
So,
in fact, this weekend we're announcing a further £20 million to fund another 15 research projects with leading UK scientists to learn more about it.
And then look after them afterwards. Let them catch it, let them suffer the risk, and then try and look after them afterwards.
That's not correct. We're obviously going to research long COVID and ensure that we have the best treatments for those people who contract it and who suffer from the very debilitating symptoms that some people are. But we're also, of course, trying to protect as many people as possible from the virus. We're doing that with the vaccine programme, as I said in answer to your question a few minutes ago.
But not children, not children.
As I said in answer to your question, we are still awaiting the final advice from the JCVI about extending the vaccine programme to younger people. It seems like a sensible thing to do. The evidence we've received so far is compelling, and ministers are going to make a decision armed with the advice in the coming days. If we can do that, then I think the first step would be to vaccinate those young people who are close to their 18th birthday, those who have vulnerabilities themselves, and those who are living in households with other people who are vulnerable.
When it comes to the app, a lot of people think it needs to be tweaked at least to make it less sensitive, that people are being pinged all the time at the moment because they've got somebody living next door to them. They're being pinged because they're next through a wall. And this is causing a huge amount of devastation to the economy and to daily life. Is the government going to look at tweaking the app?
Well, we keep all these things under review, but as I understand it, those cases are very unusual. Clearly, that's not what the app was designed to do, but they are, if you like, edge cases. And in general, the app is performing as expected. And if you do get contacted by it, then it does mean in the overwhelming majority of cases that you've come into close proximity with somebody who's tested positive, and therefore, as a precaution, you should self-isolate and get yourself tested.
Worried scientists from all around the world are now looking at what they're calling the British experiment, and they're particularly concerned that running hot, allowing the virus to run so fast through the population as we are now going to do, is going to produce new variants. If Britain produces yet another variant, will that be a failure of government policy?
Well, there's no escaping the possibility that new variants might either develop in this country or come into the country. We're trying to tackle this in a number of ways. We're taking a robust approach with our borders. You've seen the steps that we took this week with respect to France, which I know will be very frustrating to the many British citizens who either were in France or were hoping to travel there. But that was taking a precautionary approach with respect to the Beta variant, the South African variant, which may only be relatively small numbers in France, between 5 and 10%, but that's still a far greater prevalence than there is in the UK, where it's more around 0.01 to 0.02%, so very significantly lower prevalence here. And then, of course, within the UK, we'll continue to do our very sophisticated genomic testing so that we can spot those new variants as quickly as possible.
But amongst all the sophisticated testing and amongst all the observation, you are allowing this virus to run very, very hot amongst a lot of the population. And your own sage advisors say the combination of high prevalence and high levels of vaccination creates the conditions in which an immune escape variant is most likely to emerge.
Well, as the Prime Minister said earlier in the week, there's no easy answer to when we should move into a somewhat less restrictive environment or when we should move from having legalistic rules to those whereby we exercise personal judgment. But now does seem to be the logical moment to do that, despite the fact that there is a significant prevalence of the virus in society for a number of reasons. Firstly, because we're about to go into the school holidays, which will mean that transmission among the young and families will be more controllable. Secondly, because the weather is better in the summer and we're experiencing extremely good weather right now, so the climate is the most benign we're likely to have. We did look at whether or not a further short delay to, say, September would have been appropriate, and the evidence wasn't compelling. So now does seem like the most sensible time to take this step, but we're doing so very alive to the fact that cases are rising and urging everybody to exercise caution, to do so carefully.
So you talk about caution and you talk about personal responsibility. You said you'd take your mask off at the first possible opportunity, as soon as it was legal to do so. Professor Ferguson's going to keep his mask on. Are you not being selfish?
No, I didn't say that, Andrew. I was asked 2 weeks ago on another show like yours whether I wanted to wear a mask, and I said I don't particularly want to, like millions of other people across the country.
Well,
but I'll be continuing to
here.
carry a mask, and I'll wear it in crowded places.
You were asked, if you are permitted, will you be getting rid of your mask? And you replied, I will. I don't particularly want to wear a mask. I don't think a lot of people enjoy doing it. It suggests very strongly your mask is coming off. And I ask again, given what we know about mask wearing and given what we know about the speed of the pandemic at the moment, isn't it selfish to take your mask off in those situations?
Well, we're going to ask people to use their personal judgment, and my judgment will be that I'll carry a mask and I'll wear it when I'm in crowded spaces where I'm likely to come into contact with people who are not from my own household. And of course, if I'm in a business or on transport and that organisation has decided that they're going to ask people to wear a mask, I'll wear one because I respect their judgment and I respect the people who work there. And I think that's the sort of sensible, common sense approach that millions of people across the country will follow. I do believe it's right to move from a period of legal restrictions where the state tells you what to do to one whereby we exercise personal judgment and we trust people, we trust businesses to come to sensible conclusions.
I was asking you about your own personal position. Let me ask you another personal question. Would you support a tax or charge to pay for social care?
Well, we're working through options. The Prime Minister made a very strong commitment to tackle social care and to put it on a sustainable financial footing for the future. It wouldn't be right for me to comment on that right now, other than to say...
Let me ask you for your own view. Could we see a higher tax?
My own view, Andrew, is as a member of the government and as local government secretary, so I can't divorce the two. What I can say is that as local government secretary, I see every day the stresses and strains on councils as a result of the cost of delivering social care. And it's extremely important to me and the councils that I represent in Cabinet to ensure that social care is put on a sustainable financial footing.
Which is why one might have thought you had a view about how to pay for this.
Well, we have provided further funding in recent budgets through a social care levy. That's enabled billions of pounds of additional funding to flow into the provision of services. And I'm working very closely with the Health Secretary and the Chancellor, indeed the Prime Minister, to bring forward our proposals. And I expect that they will be presented quite soon.
We are now out of time. You stepped in at short notice. Thank you very much indeed for doing that and coming in to talk to us today. Robert Jenrick, thanks very much. Thanks to all my guests and to you for watching over the past few weeks and months. I will be back in September. Until then, goodbye and have a very good summer.